Once again, welcome to another episode of Ponea TV. It's always an honor when we get to engage and catch up on this health transformation journey. I am Dr. Njenga Muiruri, the Clinical Innovation Lead here at Ponea Health. For the team and myself, ours is to daily think of how we can give that friction access to healthcare for the patient through leveraging on technology. And I believe we have made some strides as we are going to figure out in this conversation, but I will allow my colleague to introduce himself.
Hi, I'm Dr. Davies Omondi, Pharmacy Lead at Ponea Health. So the thinking behind Ponea Pharmacy was that the patient journey usually ends with the procurement of medicines. And we noticed that the procurement of medicines usually is stressful to most patients, for lack of a better word to call it. Very stressful, very inconvenient, because most of the times patients are trying to get medicine A, medicine B, you go to this pharmacy, they don't have these medicines. So ours is to constantly think of how we can leverage technology to ease the pain points that patients constantly face, and to ensure that they have that convenience in terms of accessing their medicines. And in addition to accessing medicines, we also have to offer that therapeutic care that comes with the use of medications, consultations after you get your medicines, how you're going to use them. So it's tech-based, and all you're trying to use is tech to ease the user journey in terms of accessing medicines and using medicines so that we get better patient outcomes.
Yeah, that's great. And probably, Dr. would allow me to ask, how does Ponea make it possible for our audience, who are our customers, get the best prices for their medicines?
Thanks for the question, Dr. One of our value propositions to you out there is price discovery. By price discovery, I mean we give you an opportunity to know the price points of various medications depending on your needs from various pharmacies. And you'll notice, even as you walk around, Dr. and you can bear witness on this, when you go to pharmacy A, pharmacy B, and C, you'll find that, let me just use an abstract word, let me say paracetamol. Yeah? Even if it's the same brand of paracetamol, you realize that pharmacy A has a different price point, pharmacy B has a different price point, and pharmacy C has a different price point. So as Ponea, what we bring to you is we use tech to get this information for you, identify for you, help you identify the pharmacy with the lowest price point, so that you're able to choose depending on your location and how convenient you deem the service to be. You're able to make that decision. It's more of giving you an opportunity to make an informed choice. Yes, so that's what we are offering, that's what we're trying to do, and we are constantly improving. Even as new medications come in, even as we're trying to expand our scope in the pharmacy business, what we're trying to do is to give you the visibility of price so that you make your choice based on, like you have some background information to help you make that choice and to save on some costs, because at the end of the day, who's not trying to save?
Oh, great. Yeah. And probably part of what any customer would get from a pharmacy is not just drugs. Once in a while, you have other items. And I would be keen to know for the pharmacy, and it's good that our audience gets to hear this, besides drugs, what are the other products that they are able to access?
Okay, so another benefit of Ponea is that we have a platform that gives clients or customers, or gives you, our audience, an array of services and an array of products that you can access. So we do not only offer prescription medications, we also offer non-prescription medications, we offer supplements, we offer, I would call them personal care products, talk of diapers, talk of sexual wellness products, physiotherapy items, because we've realized that it's a gap really when you look at sports medicine, which is a field that's actually really coming up given the whole awareness into fitness and everything. So we have numerous items on our platform. All the supports, the ankle supports, the knee supports. These are all accessible to our users. And anytime you can visit ponea.com and search for these items, and you can always benefit from our catalog because really it's an array of products that we offer. Yeah.
Probably part of what would be critical for our users to just get a feel of is how is that patient journey for a pharmacy order? Does it mean I will have to visit the pharmacy, or do I have the option of getting a delivery done? I would just love if you would break it down for our users, how that journey goes, and do I get a chance to speak to my pharmacist? Because also whenever we visit a pharmacy, we receive some counsel from the pharmacist. So we would love to just get a clearer picture of that.
Okay, so I would look at it from different approaches, because the patient would come. The patient journey is actually really multi-pronged, because one, you can access our services through the e-commerce platform, where we give you the opportunity to upload your prescription, and then through our back-end services, we get to inquire whether our partner pharmacies have the medications. You get your quotation, and then we fill that for you. And also, you can come through the call center. You can call, or you can send your prescription via WhatsApp through the numbers that we provide. And then once you send your prescription, you can be able to fill your medications. So once the prescription comes to us, you also have another choice of whether you'd prefer to have the drug delivered to you or your medications delivered to you, or you can do a facility pickup. You can decide, well, it's convenient for me. Maybe it's facility X, it's along this road, and since I'm on that road, it would beat logic to get someone to deliver it to my place. So you can actually do a facility pickup. And yeah, it's one of the provisions we offer. We have no problem with you picking up your medication. And then once you have your medications, either through delivery or you pick it up yourself, what we really emphasize as Ponea Pharmacy is patient-centric care or user-centric care. Unlike in Daktari, you can bear witness, the pharmacy profession or the field in general is really product-oriented. It's how many volumes, I mean, what are the volumes you're pushing, how many products do you sell? But here at Ponea, we really focus on patient-centric care. What I mean is, once you have your medications with you, we'll do a callback and tell you we have given you medication X, medicine X. This is what this medicine is going to do. This is what you probably expect. These are the possible side effects. This is how you're going to use it. And we'd also give you an opportunity to ask questions, because most of the times I feel like patients are not given the chance to express themselves adequately, especially when they're accessing healthcare. So at Ponea, we give this we provide this friendly environment where you're free to ask questions regarding your medication and how you can use them, because at the end of the day, it would be a win for us if we achieve optimal care outcomes. Yeah.
Awesome. And I love that focus on patient outcomes, because the end game of any healthcare worker, whereas the revenues and the elements of how much products you push really do matter. I believe everyone who comes to us because they are certain that we are their healthcare companion, and our commitment to you is to ensure we become that reliable companion, especially in your time of most need. And Dr. Davies, I would just love to hear your perspectives on how do we as Ponea ensure that whenever we are serving our clients, and in instances when we need to do delivery, we make it remain anonymous. I'm thinking in my neighborhood where I am, the last thing I would want is you know someone, or rather the whole estate, knowing that I'm sick.
Okay.
So how do you just protect my privacy even as you deliver?
Okay. Thank you. That's actually one thing that very many people are struggling with. You see, in our culture, or normally, people tend to associate illness with various things, which maybe I would say in your medical opinion, maybe you'd say it doesn't make sense. It does not make sense. But here we are. It's a problem we're facing. So one of our unique service propositions to you is discretion. And we achieve this by ensuring that the medications that we deliver to you, or whatever service you procure via Ponea, it is nicely packaged, and it will not be, like, yes, we're a health organization, and probably once people see that Ponea logo, people will probably associate it with illness or disease, or, So what we ensure is, with our partner pharmacies, we ensure that the packaging is done appropriately. And then what we do is a discrete sticker on top, just saying Ponea Health, so that even as the delivery is brought to you, it does not raise the question of huyu amepata dawa gani, because there are also those back channels of knowing, like you'd find this medication, and then all of us know a medic somewhere. You try and ask someone, hii dawa inafanya kazi gani, or sorts. So we package it nicely and just put a sticker on top, and also we ensure that the drug is delivered to you, into your hands. We really avoid situations where medications are given maybe to the front office person, or the caretaker at our homes. We ensure that this drug is delivered to you firsthand, so that it's more of, we're trying to close all loops where you probably feel like discretion would be compromised. Yeah.
Great. I'm trying to think one of those problems that we have given ourselves to solve. Yeah. Whenever you visit a hospital, you will always find that you have a brief queue at almost all points, apart from the pharmacy, where sometimes you have to wait 2-3 hours.
Sure.
I would want to know if our clients placed an order at Ponea, the pharmacy at Ponea, how long is the turnaround time? How soon will I get my medicine? So that, if I'm trying to think through whether to wait at the hospital queue, vis-a-vis get served by Ponea Health, I'm able to make that decision and have an idea of how long that process will take on this other end.
Okay. For on-demand orders, especially for prescription medication, we normally give ourselves a maximum of 1 hour to deliver that drug, because in 1 hour we expect to have found the various price points for various providers. And just very quickly, we look at the most convenient price. Because cost effectiveness for us is key. So we look at the most cost effective option for the client. And then also, depending on the geolocation, we look at where the order has been placed from. Let me just use, from the top of my mind, if you're, let's say you're in Utawala, and I have a partner pharmacy in Rongai, it would beat logic to get you that order from Rongai to Utawala. So sure. I would definitely look for a pharmacy that is near you, so that we try and ensure that this turnaround time fits within our set target of 1 hour. Sometimes we beat our target. Sometimes we do it in 15 minutes. Sometimes we do it in 20 minutes, depending on the availability of the medication, and also how close are you to our partner pharmacy. Yes, but we constantly task ourselves to do deliveries within an hour, because we also tell ourselves, we're also trying to picture what the patient or the client is going through. Because sometimes when you make these orders, you need it for an urgent, maybe the needs are urgent.
Yeah, sure.
You know, especially, this is normally common with pain medications. Sometimes a patient is actually in pain and they request for medications. So we try, and it's constant process improvement to ensure that our turnaround times are as optimal as possible. But as it is, it's 1 hour maximum, 1 hour. Within an hour, you'll have your medications and you'll receive that call back and get the necessary care and instructions that are needed, that ideally should accompany medication use.
Thank you. So that would then make us commit to our clients that if you have that journey at the hospital, you can receive your prescription, get it on ponea.com, drive home. The moment you're getting home, your drugs are also getting home, and you get that rest that's critical for a recovering patient. I would probably want to understand, and I do understand, but it's critical for our patients, to just have a feel of what are our operation hours. If they called us in the middle of the night in their pain, are we offering a solution for that?
Okay, that's a very important question. So for our users out there, we fill prescriptions from as early as 8 a.m. in the morning to as late as 9:30 p.m. This is particularly in line with what's currently ongoing countrywide, the curfew. But really, healthcare or the need for healthcare services cannot be limited by time.
Sure.
Yes. So in case you have an emergency, in case you need anything, feel free. We have a 24/7 operational call center. Always feel free, do not shy away from reaching out to Ponea Health. We have an e-commerce platform, ponea.com, that does not shut down. So really, we are a 24/7 company. But for prescription and medication delivery, that's between 8 a.m. and 9:30 p.m. So when you make your orders between those hours, we are able to deliver it within the 1 hour that I had already mentioned.
And what happens when I do not have that prescription, but the medicine requires me to have a prescription?
Most of the times, and this is one of the challenges that many telehealth or e-health platforms are facing. Sometimes, like clients, they go and, Dr. Google. Yeah, they Google their symptoms and then they're told, or they get this results and they're told, maybe this is the particular medication that you need to use, or from previous encounters. Someone had a cold, they were prescribed a particular drug, so they feel like maybe the next time I have a cold, this is the go-to drug. So if you need a prescription medication and you come to our platform, one of the requirements, would be to upload a prescription, of which, if you do not have that particular prescription, we have an array of doctors, an array of specialties in our platform. So what we do is to upsell. We'd refer you to a doctor for a consult, after which a prescription and a valid prescription for that matter would be raised, and then we'd be able to fill your order. And maybe while at it, since I raised the question of prescription validity, maybe you just want to tell them what a valid prescription would be, how it would look like, and what are our, like the bare minimums we expect for a prescription at Ponea.
Oh, great. Thank you for that question, Daktari. Noting that sometimes patients feel as if what's being asked of them is too much, and it's good to appreciate what a prescription is and why it becomes a very critical patient document. And for a prescription, all we look for is to ensure that the originating quota, or the person originating the prescription, is qualified. So we would be interested to know the doctor that wrote the prescription and what are their registration numbers. And of course, the pharmacist from the partner pharmacy, would be interested to confirm that the medicines written in terms of their quantities and the frequency with which they are used does make medical sense. So the person interpreting the prescription becomes a second safety check. And that's why we insist on it, because we believe if you do not have, that first opinion, then second opinion confirmation, we are not able to guarantee your safety. And we are also not blind to the fact that there are people who misuse medicines, just the same way drugs are misused. And so to keep a check on that and ensure that, we guarantee safety, then it becomes compulsory for medicines that require prescription for you to have one. And when you have inconveniences in accessing the prescription, we are able to guide you to a panelist of doctors, as you have rightly mentioned, who are able to take your history and, prescribe the medicines for you.
Also, just to let our viewers know, I believe we are all appreciative of the fact that user journeys in most cases, especially in the public hospital setup, are quite uncomfortable with regards to unavailability of medications. You'd actually get a prescription, but you'd find that most of the items or some of the items on the prescription are not available. So maybe just for our viewers, how do we try to ease that pain for them? And how do we leverage on tech to solve this problem, especially stockouts and unavailability of particular medications? Yeah, so would it be possible really to come to our platform and just get all your medications all under one roof?
It's possible, and it's one of, what we would call one of our strongest points in terms of what we're building, because ideally when you walk from a pharmacy and you don't get what you're looking for, the almost natural instinct is usually walk to the next. And sometimes when there are stockouts, they seem to affect, one specific region.
Yeah.
But again, with our model where we have multiple partners everywhere, we are able, through the click of a button from our backend system, to inquire from all pharmacies on the platform whether they have that item. So unless it's literally not in the country or with the manufacturer, we guarantee that we will get it for you. Of course, for the extremely hard to find medicines, it may take longer because we have to override the geolocation of the pharmacy to get you from the pharmacy where it's available, but at least we guarantee you that we can get it for you.
Okay. Yeah. And also to our viewers who are not within the confines of the Kenyan border and maybe would require medication, are we able, maybe just to let our viewers know, are we able to fill prescriptions from outside the country, or can we make deliveries outside the country?
Yeah, where scenarios necessitate, and that's usually one subject to the laws of the country within which you reside, we are able to make deliveries, because we also appreciate that markets are different and some are more advanced in terms of what they're able to access for the patients, and we believe we cannot deny patient that access. So we are able to make arrangements for deliveries when there is need outside the country. For you to access the drugs and the various products we have from our entire network of pharmacies and providers, you just get to ponea.com, one of the best looking sites you'll find around. It's actually the first e-healthcare platform, e-commerce platform in Africa. On the left, you have the categories, and definitely from the drop-down menu, you're able to see pharmaceuticals. If you click on it, you are able to see the various products that do not require you to have a prescription, from the physio items, wearables, some of the sanitary products. And then for prescription, there is an upload option where you click upload and it prompts you. If you're using your phone, it's able to prompt you to take a photo of the prescription. If you're using your computer, then you probably already have a photo of the prescription on the system. It gives you an allowance to upload it. In case you have any additional comments, you're able to just key them in. Then we ask you very brief questions, 2-3 of them, your age, your gender, and whether you have any allergies. These are usually critical in ensuring that even as our pharmacist attends to your prescription, they're able to, take care of any issues that may arise during the drug dispensing process. Once we have the prescription, we will immediately get back to you, confirm receipt of the prescription, and let you know that we are touching base with our network of providers to get you the best prices for your medicines. Once we have that, we get the information back to you and tell you for your prescription, you're able to get it from this partner in this location. This is how much it will cost. We give you a prompt to pay. Once that's done, we dispatch the rider, and in less than an hour, as you had mentioned, you have your drugs with you. You get a call back detailing whatever you have in the pack. Of course, it will be written, but we don't take a chance. We believe in that personal touch with each and every person we serve. We believe that healthcare is personalized, and we want to give you access to the professionals who are able to walk you through that journey of your medication. Daktari, before we conclude, I don't know whether you have a concluding remark?
Pretty much what you've said sums it all. I would just tell our viewers, if you have any questions, comments, kindly do not shy away from posting it on the comments. Like our chat, like this video, and kindly subscribe to Ponea TV. It's been an honor speaking to you, and
yeah, looking forward to having you in our subsequent sessions and also serving you and working with you in health. Ponea Health is your healthcare companion.
see you on ponea.com.